All right, welcome everyone to the Dental Hygiene Basics podcast. My name is Dana. I'm your host. I'm so excited to have our special guest, Lisa Curbow, here with us today to tell you all about her RDH origin story. So, Lisa, it's your first time on the show. I'm so excited to have you here. Just tell our listeners basically kind of how you got to this point, your RDH origin story, what got you interested in the field of dental hygiene.
Well, I was kinda interested back in, like, high school, but my mom said, "Oh, you won't like that. They don't make any kind of money," those kinda things, and I was like, "Okay," and I was more on the pre-med track, and then it just kind of morphed. I got to be a dental assistant while I was deciding what I wanted to do in college because 'cause I'd already done some, was gonna do some more, and I was like, I really do like this," and so I then decided I was gonna be a dental hygienist, and that's how I got into the field.
Yeah, perfect. So, how did you get into dental assisting? I guess that's a good place to start the story.
Well, I was working in a grocery store and I had gotten married and I worked opposite hours of my husband and I thought I need to do something different and I really want to do something healthcare, but I didn't have anything that would help me do that. And I saw an ad for a dental assistant and they were willing to train and they interviewed me and hired me and trained me. So that's kind of how that easily started.
I love that. I know, and it seems like it was always supposed to be a part of your path because you were interested in dentistry, when you
Yeah.
were younger, and you
Yeah.
were like, you know what, mom, I'm going to go down that road anyways. I think it's been a beautiful journey because you've done a lot of incredible things. So tell us a little bit about what you're up to now.
So now I work in a general practice and we are not just kids, we're a family, but we see a lot of special needs. And so I'm kind of the known person in the office for seeing those special needs patients. Everybody else will see them once I kind of see them first and see how they work within everybody else's comfort zone, I guess would be the terminology. And so I'm also the office manager and hospital coordinator. So I wear many hats, but hospital coordinator works out well because a lot of our special needs need to go to the hospital and so it just makes sense for me to see them first and for me to get all their paperwork ready and go through all the ins and outs of that. That's not the full time part, that just blends in really well. But I'm clinic a big portion of the time.
Yeah, that's amazing. So thinking through, our big audience are future dental hygiene students or current dental hygiene students, and they may not even know what's possible in a career in dental hygiene, right? They probably have one track in their head, like I'm gonna, pick up an instrument and I'm gonna clean someone's teeth. And it really goes so far beyond that. Tell us a little bit about how you evolved into this particular role, because it is a very special role that you have.
It really started, ADHD is part of that, and so I've always had those, but everybody will have those. But I had this one boy, and he nothing was working for him. I mean, I started by just brushing his teeth. I mean, it was just, I was like, what are we going to do for him? We need to be able to work on him, and it just kind of got me rolling slowly down that road of what can I do to help him? What can I do differently? What devices are going to work better for him? What am I going to be able to evolve to? Or am I always going to just be brushing his teeth? I wanted to do more for him. I wanted to be able to do more orally and help his parents know how to do more with his oral care and not just brushing his teeth. So then those families talk. And so when one family is getting what they need, then they tell another special needs family that our child has this being done for them. And then it just kind of rolls from there. And then other dentists find out and they start sending the ones that, especially the ones that need sedation because we have hospital rights, or my dentist does. And so that allows them to be able to be sedated within reason. It is an outpatient surgical center. So there are some things we still can't do, but it gives us an opportunity to do a lot for them. And the goal is not to just sedate them all, but then, get them back into the office where I can clean their teeth. Some we can and some we can't, but it just kind of rolled from there, starting with the one kiddo who's now an adult. I've had him for at least 16 years. I've been working on him, if not more than that. And it just slowly evolved over time. And it's really progressed in the last probably 5 or 6 years or more. It's really progressed a lot as the word got out and I'm getting more and more. And I take as much CE as I can on special needs. I teach CE, but I take it too because you never stop learning. I may learn from this person what I didn't know before and this person what I didn't know before. And then you put them together and now you have a whole new way of doing something for somebody else.
Yeah, it's so true. And I love that. I love that you found a passion and you're taking the knowledge that you pick up on and you're giving it to other people as well. And I just think that's the beauty of once you start to niche into something that you're really interested in, you can share that with more people and more people become educated on helping patients with special needs because we know that they are a very underserved population. They need that extra help. One thing that you mentioned was I knew I want to do more for this patient. And I talk about this a lot on the podcast, how sometimes that phrase, I knew I could do more, people hear it and they think, oh, I should be getting out of the op or I should be, like trying these different things. And really doing more will come down to, I think, that patient or that moment or whatever it may be that sparks that desire in you too, right? And for you, it
Yeah.
was a specific patient that needed your help in a way that really you were like, how do I do this? How do I give back more to this patient? And I think that that's just so beautiful. So thinking about dental hygiene school, because that's what we're going to talk a lot about. Did you learn anything about special needs care when you were in dental hygiene school?
Not really, and granted, I graduated almost 27 years ago, so it was different then, so it wasn't part of the CODA, requirements, so we didn't really talk much about it. We did a little bit within, different illnesses and different, syndromes, we did that way, but other than actually treating patients, we didn't have any patients treat. Of course, we're responsible for bringing our own patients in, so, that's part of it, but no, I didn't really have any special needs until after I'd graduated.
Do you know are programs offering more special needs, like rotations and things like that now?
Well, when I've talked to the ladies that graduated around me more recently, so it is part of the CODA accreditation, but they are telling me that they're doing patients with anxiety. Again, they're required to bring somebody in. So if you don't know somebody, you don't know somebody. And so they'll find what they can, which may be high dental anxiety or ADHD or something like that. So they're trying, there's just not a lot there. And where I'm at, we have a junior college. And so it's an associate's degree, but if you're in somewhere like, say, A&M or UT San Antonio, they have whole special needs clinics, which would give you a lot more exposure to that. I assume the dental hygiene part goes through that a little bit, but around me, it's still limited on what's
Yeah,
there.
and I do a lot of work with students and education, helping them prepare for boards and things that we do see. They do like to test on concepts like that, special needs,
Mhm.
but it can be hard if you've never treated a special
Yeah.
needs patient before. But at the same time, something you were mentioning is depending on the program you go to, you may get more exposure. And so if you're listening to Lisa's story and you think that sounds like something I want and I want to learn how to do that, or maybe that's the path I want to go down, maybe that's a school that you should seek out, right? Or ask those questions in your interviews, what kind of training on special needs do you give? Because I think that's the path that I want to go down. And starting to kind of think ahead. That's why I love meeting with a hygienist like you who do something a little bit different than just, traditional general dental hygiene. I think it's really good for students to hear that and then start thinking, get the wheels spinning. Where do you want to go from here? So, where did you go to dental hygiene school?
I went to Tyler Junior College. TJC is what most people know it as. The
Yes.
program's been around since the 70s, so it's a pretty old program.
I know, and you have a great program, a beautiful clinic out there, lots of wonderful professors. I've met a few of them traveling around at different, events and really, really great school there. So when you applied to dental hygiene school, did you get in on your first attempt or did you have to apply multiple times?
I got in the first time. I didn't even know
Wow.
that that was uncommon, but yeah, I did.
I know because you're working at a grocery store. Were you working on prereqs while you were in the grocery store or at the dental assisting office? How did that kind of play out?
I already had an associate's degree at that point, and so
Okay.
I didn't have any prereqs left because I was pre-med, and because I was pre-med, everything I had taken was what I needed to take, so there was nothing left to take. And basically,
Yeah.
I took a year off to figure out, was I gonna do nursing? Was I gonna do dental hygiene? Was I gonna do something else? So I applied during that year off.
Okay, and then you got in, so it all
I
worked
got
out.
in.
Yeah,
Yeah,
I love that.
yeah,
It seems like destiny stepped in and took you right where you needed to be.
yeah.
I love that, I love that. And so once you got into dental hygiene school, what do you think was one of the most difficult aspects while you were there?
One was finding the patients, that was always a problem. It just
Yes.
it's so because you have all these requirements to meet and finding the right patients. You have plenty of people who didn't meet most of the requirements, like they go every 6 months and they're like, "Oh yeah, I'll be your patient." Well, that's great, but you're not the patient I need for this requirement. I met your requirement. I need these other patients.
I
So,
know, that is one of the biggest challenges. So thinking through, because you said you graduated 27 years ago, is that what you said?
yeah,
Yeah.
99 is when
Okay.
I graduated.
This was before the days of social media, which I think social media it makes looking for patients so much easier, right? I
Yeah.
mean, and there's like you can create a Google form and have patients fill it out and sign up on your calendar. Like there's so many cool ways to do it that even I didn't have access to 10
Yeah.
years ago.
Uh-huh.
So, how did you find patients in 1990, 1997, 1999? Sorry, I got the
I graduated in 99, so it was
yeah.
97, 98 when I was looking. So they would keep a list in the office. People could call in. A lot of the local dentists would refer patients if they couldn't afford it. They'd say, well, maybe go to the dental hygiene school. And so they would call, you recruited everybody in your family, every one of your friends, every one of your family's friends, people you hadn't talked to in 10 years. You called them up and said, hey, how long has it been since you've had your teeth cleaned? They had a little program at the time of this group. I call it a group home. It's not really what it was, but like a group home that most of them had not had their teeth cleaned in a very long time. And they would bring them in and they would bust them in for us. And so we usually got some really big requirements. In fact, my biggest requirement my last semester was coming from that home. And the person was, I guess, graduating out of that home. And I was like, oh no, I have 1/4 of your mouth left to do. 1/4, please come back. Please come back. He absolutely promised he would, gave me his wife's phone number, everything. And the day came he was supposed to be there, and I was so nervous. He showed up. I'm like, yes, yes, yes. That was really nerve-wracking because it was on his own to come in at that point, and he easily could have just walked away. So that was really good because that they brought in lots of people, and most of them were our big requirements. So that was very helpful that those people came in.
Yeah, and great experience for you as a student as
Yeah.
well. But that is something, most student or most clinics have a list. So I know students get really nervous. They're like, I'm starting from scratch. But there's usually a list. Sometimes you can get a list of patients from your senior, right? Like whoever your senior
Yeah.
mentor is. Sometimes you can, friends, family, like you said. And maybe that's not always the case if you live somewhere. Like I moved away, so I really didn't have anybody in San Antonio. But granted, I lived in a city with millions of people. So I'm like, there's always people that need to get their oral health taken care of. And I love that he showed up. That's a story that good things do happen because there are
Yeah.
a lot of highs and lows when it comes to clinic and finding patients. But I just think that, you have to celebrate the wins. In that case,
Yeah.
it was a win, right?
It was.
I
Yes.
love it. I love it. So thinking through dental hygiene school, how did you pay for dental hygiene school?
So I had a scholarship that basically it stayed at TJC. So I had a little bit of it left. I'd used part of it already, but I had a little bit more and it was very small, but it helped cover a few books. I got loans, but dental hygiene school was different now then compared to now as far as how much it costs. But I did get loans so that I was able to afford it. And I also still worked in the dental office just a day or two a week, and I gave a lot of plasma.
You're the first one who's told me they gave plasma. Hey, it's an option, right? Like you're like,
Oh yeah,
I might have given a kidney if someone needed it and I might get paid for it.
I did.
Oh, that's so funny. So how much were you making earning giving your plasma?
Well, back then it wasn't much. I wanna say it was maybe $50 a week, maybe 35 to $50 a week, something like that. It wasn't very much,
Hey,
but
we'll take
anything
it.
helped at that
Yeah,
point.
gas and groceries, right? That
Yeah.
those things add up. You got to get to class. Yeah, that's hilarious. I love that. Well, I tell people, I was one of those like I would basically sign up for research studies, and just let
Oh,
them do like crazy stuff like psychological testing. And I was like, I made $300 in an hour one day. I was like, I can't do that doing this my current job as a dental
exactly.
hygienist. So I'm
Yeah.
like, I got to make this count. And so there are a lot of options out there to make money in dental hygiene school. And I guess the beauty, if you're giving plasma, you're just sitting still so you could still study, right? Doing it. I love that. So after you graduated, did the loans feel insurmountable, or do you feel like, with the ability to make good money as a hygienist, did that help you once you graduated?
It did. I mean, when I think back to what I made per day then compared to what I was paying for my loans, it's probably comparable to now because we made so much less back then. For us, it was a lot have not been married very long. We had just bought a house and it was like, oh my gosh. But I did everything I could to pay it off early. And I think I had a 10-year loan and I paid it in 7, something like that. So I paid it off early because I wanted out from under it. And when I paid that off early, it was like, okay, that's just done. I don't have to worry about that anymore.
I know it's the best feeling in the world. And what I always tell students is, when we're thinking about finances, it's something I like to talk about because I mean, we don't learn those lessons. You don't go through college and they're like, here's a personal finance course, right? Like,
Yeah.
here's debt, here's interest, here's capitalized interest, you know. And until you see that accumulating and growing, you don't know what the weight of it's going to be like. But then once you pay it off, you realize how much money is yours and that you get to keep, right? And then you
Yeah.
can use that for other things in life, which is always really, really amazing. So I love that. You know, one thing I was thinking of, you've been in this career practicing clinically the whole time for 27 years. You've been practicing
Uh-huh.
clinically. That's
Yes.
amazing. So we see all of this negativity online. I don't know if you see it, but I see it because I'm always looking at, you know, students and they're like, should I become a dental hygienist? And all these old crusty hygienists are like, no, no, no. I say no. Some of them are like, I graduated 2 years ago. I wish I wouldn't have done this anymore. And I always try and comment something positive because I'm like, it's been 10 years for me. I still love dental hygiene. I have chronic pain, so I cannot practice full time anymore, but I do still have a place in my heart for it. And when I get to do it, I love it. But what would you tell that student who's seeing all of that negativity online? Would you still recommend becoming a dental hygienist 27 years in?
Yes, it's just it's hard when you see all that to not take it in. My first thing is stay away from it. Get out of the groups that do that and get into the groups that go the opposite direction, the ones that really build it up, the ones that really kind of help you find your groove. Find your groove. I really say, like, I should have started going to conferences a long time ago. Didn't really work out. Kids were little, those kind of things. And now that I have, it's like, oh, I should have done this, especially the dental hygiene conferences. I should have done this years ago because that just really excites you about it, shows you all the possibilities of things you can do, instruments you can use, different ways of doing things that you didn't learn in school. Every time I come back from a conference, I'm all just pumped up and excited about, okay, look what else I found. Look what else we can do. But here's how else we can help our patients. And I work for a great dentist, and that's another key. I work for a great dentist. It's like, go for it. Anything you find, bring to me. We'll see what we can do with it. So I have worked for offices that are a office, really. It was one office that was not like that. And I did question it. In fact, so my uncle is a dentist. He's retired now. And I was talking to my aunt. And while I was working for this one dentist, I said, if he had been the very first dentist I worked for, I would have thought I'd made a mistake because I had worked for a good dentist before. I knew better. And she goes, "Yeah, your dentist can make or break you." And so I didn't stay there very long, about a year and a half, maybe, or maybe just a little over a year. And then I got into another office with another great dentist, and I've been lucky to have mostly great dentists with one that basically said I didn't learn anything in hygiene school. He'd teach me everything I needed to know. And that was if I'd have started with him, I probably wouldn't still be in dental hygiene. The office makes a difference. If you don't feel supported in that office and you think you've made a mistake, find a different office. Find your people and make sure you have if you have other hygienists, it's hard when you don't have other hygienists working with you because you can get really isolated, you can feel alone, you don't branch out, you don't learn. But when you have other hygienists, you can bounce ideas off of them. You can say, "Okay, well, I know you've worked other places or I know you went to school at a different time. Give me some ideas. Let me tell you some things I've learned." And you grow from one another and make great friendships. So your office makes a big difference. So if everything is negative, find a new place, get off those social media accounts, do whatever you have to do to find the positivity because what goes in is what comes out.
Gosh, that is so true, Lisa. And I wish I had heard that advice whenever I had first graduated. You know, the first office I worked at, it was great. You know, I had a really, really kind doctors and I worked with other hygienists. So I had mentors, which was really nice, but it wasn't really my style practice. It was just too fast paced and the mindset wasn't really matching me. And there was a lot of negativity around the office. So I was like, okay, I need to make a transition. I was also commuting like an hour a day, like the one way each way. And, you know, I just felt like I never saw my family. Everything was crazy. But then I transitioned to a different office thinking, okay, things are gonna be better. I was the only hygienist. I had plenty of time, you know, and things seemed really great. But then I had so many issues with the dentists themselves, right? So it makes it really challenging because it's hard to find that perfect unicorn office. But I think younger graduates, you know, people who are coming out now, they're at least hearing these stories and they're hearing, you know, don't settle for what people are, you know, how people will sometimes treat you in the dental office. And you do know a lot. Your education provides you with a lot. But like you said, we also always have a lot to learn. So going to those conferences is so,
Mhm.
so important. And so which is your favorite conference?
RDH under one roof.
Yeah, and that's
Yeah.
where we met this past
Yeah.
summer, and, just in passing, which was great, and I loved RDH Under One Roof too. It was my first year going, and I had the exact same sentiment. I wish I would have gone earlier. I think had I gone when I was at a really low point in my clinical career, I think it would have really turned things around for me. So anybody who's out there listening, well, maybe I'll try and air this around graduation season, thinking through like, what do I want life to look like after graduation? And I do think it's so important to visualize your life, right? Because it
Mhm.
plays a big role in what you end up doing and achieving. Go to those conferences because they are amazing. So now that, you're looking back on dental hygiene school, Lisa, and all the amazing things that you've done since then, what advice would you give to a student who's in school right now?
Definitely keep studying. Find all your study buddies. There's all kinds of stuff available to you now that I didn't have, like all the online stuff of being able to study. Those are amazing. Find different people on social media that are giving you the advice of saying, "Hey, I just graduated. Here's some of the things, the tips and tricks I learned." Find those. Those are amazing. I watch them now and thought, "Man, I wish I had that." So, but we did little study groups. We found people within like the way we sat in rows, it would usually be a couple of people around you, and those were your people to really study with. I rode with one girl. We both lived about 20 minutes outside of town. And so we would ride in and take turns driving, and we would kind of quiz each other a little bit on the way there. Hey, did you understand this? Those kind of things. And don't be afraid to ask questions. If you don't understand, ask. Find things online to help you learn. Go to the teachers and see if you can do some tutorials, or if there's an old, like if you're the beginning and you have an older person in your class, sorry, like we had freshman and sophomore, even though it was, 2 years. So if you're freshman and you have a big sis or something, ask them questions and use all the resources you have.
Yeah, such great advice. Something I was thinking about, I love talking to people who graduated, before the era of social media and all of those things because we did things differently, and even so just kind of thinking about the progression of time and the resources that we have. There are so many resources available, but I do think that there's still an element of kind of off the computer screen learning that has to happen, right? And some of that
Mhm.
is building critical thinking and, utilizing information that you're learning in class on the clinic floor. There's a lot of things that the computer can't do for you, you
Yeah.
know. Do you have what is like the top way that you studied in dental hygiene school? Were you like write notes, listen to notes, like flashcards? What type of studier were you?
Recorded it. I took notes, but I recorded everything. And I would play it back while I read my notes because sometimes I missed something, or sometimes when I wrote it down, it's like, I don't understand. And then I would listen to it. It's like, okay, that helps. That helps.
Yeah. Yeah, really great tip. Yeah, and you have to ask your professors if they are willing to be recorded. I know that's like a thing nowadays. Like you have
Yeah.
to get permission, and sometimes they'll say it in the syllabus, they will or will not allow you to record. But it does make such a big difference to hear what they said again, because like you said, you might be rereading it going, wait, I thought I got it in class, but now when I look at it on the
Yeah.
PowerPoint or on paper, it does not make sense, or your notes don't make sense, right?
Yeah.
You're like, what was I trying to write? Yeah, that's really good advice. And what about flashcards? Were you a flashcard person?
But not a whole lot. In fact, when we were doing, like, they didn't have a lot of PowerPoints. They had a lot of still overhead projector, like your transparencies and stuff. So I drew a lot of pictures. So my notes were really good as far as I was able to flip through those. So I didn't do a lot of flashcards with them. No,
Yeah,
I don't
yeah.
know. They didn't do well for me.
That's okay. Well, yeah, if you're spending so much time into your handwritten notes, right? You're like,
Yeah.
I probably don't need to turn around and rewrite them on a
Yeah.
flashcard. But I think that's where students miss some of that opportunity nowadays because of, while there's the benefit of all the changes to technology, there's also some downsides. Like we lose a little bit of the connection that you have when it's just you and the teacher and you don't have those resources to come back to again. I remember in school some of my teachers would not give us the PowerPoint, so you were like, I have to take notes. That was still a skill that was still used when I was in school. So I think there's something to be said about those ways of learning and still implementing them while also using some of the nice new resources that are available as well.
Yeah.
I love it. I love it. Well, tell our listeners where they can find you so they can learn all the amazing things that you're doing and see all of your amazing content as well.
So I have a website. It's just simply lisacurbow.rdh.com. I'm on Instagram as Lisa Curbow RDH, and a TikTok is just Lisa Curbow. It's listed as Lisa Curbow RDH, but if you just put Lisa Curbow, you'll find me. So I try to make it as simple as I can.
That's smart. That's the way to do it. Well, thank you so much for sharing your story here on the podcast. And we just appreciate you so much and good luck with everything in your career.
Thanks for having me.
Of course.